Good morning, I'm Dr. Martin. Happy Thursday. This is the Institute of Regenerative Education, and it's been an interesting week. We're going to go through it a little bit. So, as many of you know, I still see patients. I'm an interventional pain doctor, but I talk to a lot of doctors. I think I talked to 22 doctors last week. And I've probably trained 5,000-6,000 doctors, or at least educated them on the use of allogenic biologics as it pertains to the practice of medicine. Not the use of allogenic biologics to diagnose, treat, cure, prevent disease, right? And some interesting things happened this week. First and foremost, state of Georgia passed a stem cell bill. Now, it didn't happen this week. It was ratified the first week of July, but it signals a shift, in a shift that I've seen coming and I've been talking about for a while, that is more and more states need to become competitive in this regenerative medicine marketplace because the dollars are following the patients. Patients that were traveling to Mexico and Costa Rica and Panama, they're not doing that anymore. They're staying in Florida, they're staying in Utah, they're staying now in Georgia, right? They're staying in Tennessee. And they are relishing the fact that their providers now have the ability to offer them something that otherwise they'd have had to fly overseas for. And, risk health and Lord knows what, getting some mystery product from overseas. And I call it a mystery product for that very reason. None of the products that are being sold in a lot of these places overseas are made in U.S. facilities by AATB guidelines. There's no, safety and sterility testing. None of that exists, right? They're still using pluripotent stem cells. Lord knows, how many generations they're expanding these cells. And so all that has risk. Now, on top of that, I've talked to more orthopedic surgeons than I've ever talked to. I think I've talked to 7 this week. Now, for all of us that are providers, right, and I'll say this admittedly, I did not study hard enough in college. Spent way too much time out partying or whatever else, right, in the gym, Lord knows. But I didn't spend it studying. I was not top of my class. And I was absolutely not top of my class in medical school. I went to school in the Caribbean. I simply wasn't smart enough. I didn't score well enough on the MCATs to get into a U.S. medical school. And so there's no prayer I was ever going to be an orthopedic surgeon because you did have to be top of the top to be an orthopedic surgeon. And by and large, the orthobiologic application of regenerative medicine products has really been the purview of orthopedic surgery since it was founded. And where the ortho goes is where the community goes. And for a long time, orthopedic surgery was squarely set in the autologous biologic space. And that is the premise of this lecture, eyes wide shut. This is not to disparage any orthopedic surgeon. This just is what it is. I just speak facts about a situation because the market and the environment has changed. And let me walk through how, and let me walk through a conversation that I had this week. And that all falls secondary to an Instagram video I saw this morning, early. This surgeon basically saying that, he wasn't going to risk his license to use anything other than autologous products for orthobiologic application to treat osteoarthritis. And as I've pointed out before, there are warning letters to a very large company called eStar Technologies, and all they make are PRP kits and bone marrow aspiration kits, marketed to treat osteoarthritis, marketed to regenerate cartilage, marketed to treat pain. And as I've said a million times, right? The FDA is your friend. You can't use any human cell and tissue product to diagnose, treat, cure, or prevent disease. And human cell and tissue products are inclusive of PRP, PRF, A2M, PDGF, stromal vascular fraction, bone marrow aspirate concentrate, and umbilical cord derived products, right? All of them are human cell and tissue products. You can't make claims using any of them. None of them can be used to treat disease. And so the conversation that I had with this orthopedic surgeon was interesting. He was a specialist. In by all rights, he had done everything. 2 fellowships, was literally the expert in arthroscopic shoulder surgery. That was his niche. That's all he did. That's all he loved, and he was probably the best at it. And the problem is that the market moved past him. And he was slowly coming to realize that. And that's why he was on the phone with me. Because he had mastered a single procedure. Now, I don't want to say single procedure because arthroscopic, approach to the shoulders can be applied for many different pathologies. But by and large, his bread and butter was labral and slap and complete rotator cuff tear. And he was the guy. If that's what you had and you needed to get back to competitive, even professional sports, he is the guy still. Well, what's happened? Well, reimbursement for orthopedic surgery has fallen 33% over the past 10, 15 years, and it's continuing to fall. The hand surgeons have seen 50% reduction in some of their codes, 50% reduction in their reimbursement over 20 years. Now, I'm sorry, that's not sustainable. It just simply is not sustainable. And so what's happened is because reimbursement's fallen, what are rotator cuff patients doing now that the market has shifted? Well, they're no longer going to see surgeons. They don't want to see a surgeon. Why don't they want to see a surgeon? Why would a patient no longer want to see somebody who's better than anyone else at that specific singular thing? And it's because patient behavior has changed. Patients no longer want to pay huge sums of money for a surgery where they're going to be sitting in, the whatever Captain Jack position here with this big brace on for 6 months, only to have complications from the surgery, frozen shoulder, excruciatingly painful physical therapy. They've heard all the stories. They've seen their friends and their colleagues not do well, even in the best of hands. And so they're choosing to go more functional, more rehabilitative, more holistic routes to see if they can just live with it. Because they don't have the time to take off and not live their life. And so they're going to see regen providers and functional health providers and chiropractors. And as they go, they're taking their money with them. The money that they would have otherwise spent on a $15,000 deductible or surgery center fees that top 20 grand. That's a ton of money. And they're saying to themselves, well, I'm going to spend $20,000 one way or the other. And in one, I can't work for 6 months because my job requires me to use my arm. And I still have fairly good range of motion in my arm. It hurts, right? But I still have fairly good range of motion. I can do my job. I can't afford 20 grand in copays and not be able to work for 6 months. So maybe I'll go see the chiropractor. Maybe I'll go see the functional medicine doctor. Maybe I'll go see the integrated or the regenerative medicine provider and see if they have something else to offer where I can still go to work. I can still have some measure of quality of life. And what is becoming true is that the depth of your experience, the depth of your training used to be a moat, right? It used to protect you from any and all outside competition. You were a moat unto yourself. No one could hurt you. That's not true anymore. Now, your moat is your liability. And the reason your moat is your liability is because your eyes have been wide shut. You haven't seen the turn. And the turn is that now, if you're not going to treat the whole patient, well, the whole patient's going to leave your office. Patients don't want to have to go see 7, 10, 15 different doctors. They'll spend the money for one doctor to take care of them as a whole. They don't want to get bounced around from consult to consult to consult. They don't want to wait in 7 different offices in a week and sit there for an hour and a half in the waiting room to spend 15 minutes with the doctor and then get a massive bill that they still have a copay for. They don't want that. They would much rather write one check, spend an hour and a half with a doctor who can actually address more than just the one thing that's wrong with them in the 10 minutes. Cash follows the wider lens. If I'm only an arthroscopic surgeon of the shoulder and I don't have any capacity to treat that patient other than surgically, I'm only capturing a fraction of the patients walking through the door. And usually it's those fraction of patients that say, I want surgery. They're in saying they want surgery. They've made up their minds. That's only about 30% of your patients. What happens to the other 70%? Well, they walk. So you're getting fewer and fewer patients into your office that want surgery and more patients that want alternatives, but your eyes have been wide shut. You don't see any other alternative because you're only the best at surgery. You're not the best at the holistic care of a patient. Non-surgical alternatives. And this has suddenly become the crux of this entire conversation. The rate limiting step in all of medicine is being able to see the landscape and being able to see where the patient dynamics are going. Now, if we just read the literature to maintain certification, we're just reading the stuff that we're familiar with. We're reading tons and tons of shoulder arthroscopy, literature, and we're doing just that as far as our maintenance of certification, right? So that we keep a certificate. The problem is, you can have all the certificates in the world. You can have, 200 hours of CME. But if that 200 hours of CME doesn't make you more capable of addressing the patient as a whole, those patients go somewhere else. Because our patients are not the simple rotator cuff tear. They're not the simple slap. They're not the simple impingement syndrome. They have that, but they also have POTS syndrome, or chronic Lyme, or long COVID, or chronic Epstein-Barr. And I'm not saying that an orthopedic surgeon should be deep in the ability to treat all of those things. But patients walking in your door, walking in my door, are not coming in with just an acute lumbar radiculopathy. That is just the cherry on top of a whole banana split of other pathology. And if you have no ability to even empathize with all the other stuff that they're going through in your mind. Look, I'm just here to treat your shoulder. You're gonna have to go see your primary doctor or some other quack to take care of all that other stuff. You've lost that patient. Because they're suffering with that shoulder injury in addition to suffering from everything else. I talked to this ortho who had, just scowl on his face for the entire time I talked to him. Literally just scowled through the whole conversation. And I anticipate he does the exact same thing with his patients. Now, why is he scowling through the entire conversation talking to me? All he wants to do is go back 10 years ago. All he wants to do is go back to when he was King Kong, when patients would get down on their knees and worship him because he was the almighty orthopedic surgeon and he was going to fix their problem. They aren't King Kong anymore, right? They're still the best trained at what they do. The problem is the market has moved. Patients want more. It's not enough now to go to a restaurant and get Mexican food. Unless it's a really great, authentic Mexican restaurant. They're making handcrafted cocktails. They make your guacamole, at the table, right? And they have 15, 16 different ingredients for the guacamole, right? And there's some guy playing Spanish guitar in the corner. Your restaurant's not busy. This is happening to doctors as well. If you have zero regard for everything else that's going on with the patient, what the patient knows is that the shoulder might get better, but everything else they're suffering from gets worse because you neglected the whole patient to treat the part. And this is the problem. There's so much focus on just what I know that dollars are disappearing from those offices. And if you're not able to look up and see the landscape and see what's coming, you're going to see your patients walk out the door. And as you drive to work in your whatever, Ford Raptor, right? And you sit at the light and you make a right to your office. The integrated chiro's sitting in his Spectre, his Rolls-Royce Spectre, and he's making a left into his. And you're collecting 33, 36% less to see that patient. And he's collecting cash to see his. Now, what's the difference between the two? It isn't training. They're both well trained. It's that nurse practitioners, integrated chiros, functional medicine doctors, regenerative medicine providers that see the world as larger than autologous simply have more to offer. I'll close with this. And I'm going to drop receipts. I'm going to put a whole list of receipts that backs this up because this just isn't my opinion. I see this every day because I talk to 20 doctors a day. But I always drop receipts, so I'm going to do that as well. But I have a conversation with the director of a spine program at an Ivy League institution. I'm not going to say which. And he had just hired 2 young new doctors who were really excited about regenerative medicine. Now, this is a Northeast, storied powerhouse of an academic institution. And at first blush, as I got on the phone with this gentleman, I was like, this guy's King Kong, right? I mean, he is King Kong. Top of the top, elite institution, very bright guy, and remarkably humble. And he said something that almost shook me. He said, I don't know enough about this, But in my fellowship, I actually studied exosomes. That's what I did. And so I understand that I have more learning to do, but I have a foundation for this. And it's going to take me a bit to get up to speed. But I have two young guys who are about to start. And they're really excited about PRP and BMAC. And he said, and I like that. But he said, it's critically important to me that they talk to you, Dr. Martin, and you pour into them, because I don't want them to approach this practice with what has been. I want them to approach this practice with what can be. I'm very rarely speechless. Well, every now and then when I see my wife, yeah, speechless. But I had nothing to say. I had nothing to say. That is someone who, in a very conservative, elite East Coast teaching institution, does not have his eyes wide shut. And even though he appreciates his own limitations, he's running a program. And in running that program, he wants to be able, as a program, because their clinic works as an entire group, he wants them to be forward-leaning and forward-looking. He said, I need you to teach these two young guys everything you know about allogenic biologics so that they at least can offer the full spectrum of care, because I'm tired of my patients leaving and going to Mexico and coming back saying they spent $20,000, $30,000, $40,000 there, when I know, as one of the best teaching institutions in the country, we can do a better job right here. I'm Dr. Martin. Have a very blessed day.